So, what do you guys know about HPV?
I know that is a STD,
Okay.
and I've heard that it's a virus.
Yeah, it is in the name, human papillomavirus. So, human papillomavirus is the most common sexually transmitted infection. It is transmitted through sexual intercourse, also anal sex, oral sex, and it's only enough to have skin-on-skin contact. And pregnant women can also pass it to their baby during delivery. The baby will develop something known as recurrent respiratory papillomatosis and will show as warts on the back of their throat. Some signs and symptoms for HPV are in 90% of the cases, the immune system clears the HPV virus within 2 years. But there's no way of knowing which ones are going to be cleared and which ones are going to develop into more complicated diseases. I don't know if I mentioned, but there's 40 different types of HPV viruses, and they develop into different types of problems. Some of them develop into genital warts, and they also develop in males and females, and also cancer that can be cervical cancer or cancer of the vulva, vagina, penis, anus, and orthopharynx, which is the back of the throat. It is very important to know that whatever causes the genital warts doesn't cause cervical cancer. So there's different strains of the virus that cause these diseases.
As we said before, most people don't know that they're infected with HPV, and they never develop symptoms. And certain types of HPV don't go away over the years, and that's when it starts developing cervical cancer. So it's important to get regular testing and screening for cervical or HPV and cervical cancer, because you don't start developing those symptoms until the later stages of the cancer. And it's also the easiest type of cancer for women to prevent with regular screening.
So vaccinations and screening are two really effective ways to prevent HPV virus from turning into a really chronic infection. And those are highly recommended to get. Also, you want to limit your sexual partners. That will help decrease the risk of developing the HPV virus. And lastly, when you are having sexual intercourse, you want to make sure you wear a condom, and that will lower your risk of developing the HPV virus. However, it will not prevent it completely, but it will lower the risk. That is good.
The Pap test is the most common type of screening, and it's recommended for women to start getting that once they hit the age of 21, and then all the way up to age 65. The Pap test only screens for cervical cancer. And so starting at age 21, it's recommended for women to get it every 3 years after that. If your test results come back negative, your doctor may tell you that you don't have to get it for another 3 years. Then starting at age 30, it's recommended every 5 years. So women should still be getting screened even if you think you are too old or if you're not having sex anymore. And then also, your results may take up to 3 weeks to get back. If you have any abnormal results, your doctor will notify you directly. And it's also important to remember that even if you have abnormal results, that doesn't mean that you have cervical.
Any questions? I do. What is the PAP procedure like? Okay, good question. So you're able to get the PAP test through a clinical or your doctor's office. The doctor will place a plastic instrument called a speculum that will hold open the vagina, and then he will examine the vagina and the cervix and collect a few cells and some of the mucus from the cervix. Those cells will be sent to the lab via a slide or a bottle with fluid that preserves them, and they're going to be looking for any abnormalities in cell growth.
I have a question too. How do I prepare for my Pap test? Do you have any?
Yeah, so you're not going to want to schedule your Pap test when you're on your period.
if you schedule it for the next 2 days. In those 2 days, you don't want to use tampons, you're not going to want to have sex, use any types of birth control, foam, jellies, creams, as well as any vaginal medications.
2 vaccines available to prevent HPV. These are Cervarix and Gardasil. Gardasil also prevents genital warts and has been shown to prevent some cancers of the anus, vulva, and vagina. Both vaccines are given in 3 shots over a span of 6 months. And vaccination is recommended for girls ages 11 and 12, but is also recommended for women ages 13 through 26. Ideally, females should get the vaccine before they become sexually active and exposed to HPV. Females who are sexually active may receive the vaccine, but because they may have already been exposed to the types of HPV, they may benefit less from the vaccinations. However, both vaccines are highly effective in preventing the targeted HPV types, as well as the most common health problems caused by them. Research suggests that vaccine protection is long-lasting, and current studies have followed the vaccinated individuals for 6 years and shown that there is no evidence of weakened protection over time. As far as vaccine safety, both vaccines have been licensed by the Food and Drug Administration, and the CDC has approved these vaccines as safe and effective. Both vaccines were studied in thousands of people around the world, and these studies showed no serious safety concerns. Side effects reported in these studies were mild and included pain when the shot was given, fever, dizziness, and nausea. Vaccine safety continues to be monitored by the CDC and FDA. However, pregnant women should wait until after their pregnancy to get vaccinated, because while there are no studies that show that there is harm caused to the infant, more research is still needed. Also, fainting can occur with any medical procedure, so it is important that adolescents or adults be seated or lying down for 15 minutes after the vaccination.
So there is actually no treatment for the HPV virus itself. However, you can treat the infections that are caused by the HPV virus. First of all, visible genital warts is one infection that can be caused by it. About 90% of genital warts are caused by the HPV virus. And the different treatment options are either you can just let it go away on its own, that's very possible, or you can get a medication and that will get rid of the warts, or you can go to your medical doctor and he can get a treatment for you. All of those options work the same way. Also, abnormal cervical cells, these ones, there's treatment options. You have to go to your medical doctor to get those. You do want to get screened for those so that if you find them early on, the treatment options will probably be more effective. Also, there are other HPV-associated cancers, and same for those. You want to go to your medical doctor to get treated for those and to get screened, as Jenna mentioned earlier. You want to go get screened early on so you can start the treatment process earlier. And lastly, we have recurrent respiratory papillomatosis, and this is warts that grow in the throat. In order to treat this, you have to get surgery or use medicines, and sometimes it might take multiple surgeries or medications for it to be completely treated. So this concludes our info panel on HPV. I hope you guys learned a lot today, and if you have any questions, you can ask us after the class or go on the CDC website and look at more information. Thank you.